coming moments, but we want to get started because we've got a lot of content to cover today, and we also want to be able to get to your questions. So welcome, everybody. Thank you so much for joining us today. My name is Victor Robertson. I'm the Director of Executive Operations here at Rocky Mountain Human Services. We are very happy to have the opportunity to meet with all of you today and present some information, get your questions, and have a dialogue. So thank you for carving out the time. We are going to have a number of presenters today from throughout the organization presenting a wide range of information that pertains to directly to your work. And I want to thank you also for RSVPing, and for those of you that gave us some content ideas in your RSVP. Thank you for doing that. We really did make our best attempt to address all the suggestions that came in on those RSVPs. So I'm hoping through the course of this PowerPoint, you will see if you asked a question or suggestion that we are talking about that subject. And if not, we have the chat enabled. We want to get through all the slides first, but feel free at any point during the presentation to put your question in the chat. Once we get through all of our prepared content, we will go back through and see if we didn't get to that question at some point in the PowerPoint, we will address it towards the end, time permitting. We do have 1 hour, so we are going to try and be as efficient as possible. We really want to deliver all the content, and anything we may have missed, we want to address your questions. One reminder is let's try to, we're going to give you some ways to access help for specific client scenarios. So we don't want to talk about those in today's meeting, and we don't want that going into the chat. And in particular, please don't put any protected health information. We don't want any HIPAA violations going into the chat. So just be mindful of that. But other than that, feel free to pop questions in the chat as we work our way through the presentation. So with that said, I'm going to introduce you to Tammy Arnold and let her introduce herself and give you an overview of today's content.
Tammy, if you're talking, you're muted.
Yep, I hit, it just didn't want to go off. It wanted to leave me in there. Good afternoon, everybody. This is Tammy Arnold, and I'm so happy to see so many people in attendance today. We had a great turnout on Tuesday, and a lot of people have reached out to me in between, so that's great. There's a lot going on right now, and this is the most complicated time I think that any of us have ever encountered in Medicaid. I've been in Medicaid 18 years, and I still learn new things all the time. It's amazing to me how complicated the program is, and one of my duties with RMHS is to help you navigate some of those complexities and to help you get the answers you need to why isn't someone's case the way it should be. So I am that person that you can send that protected health information to. Please send it securely. I can look into all of our systems and see where a case might be hung up, see what the issue is. We've moved several this week. I keep a list of the ones that I work, and we've moved a lot of cases forward, getting them resolved this week. I'm so proud of our team. So I look forward to working with you all. We have a lot of information we're going to share today. It's a really packed agenda. So if we could go to the next slide, please, Victor, I'll kind of give you an overview of what we're going to talk about today. And we hope we can answer most of your questions, but as Victor said, just a general reminder to send your questions in the chats if we don't answer them. Also, if you don't get your question answered about something, you can reach out to me afterwards. That's what my duties are for. Could we get everybody to mute their lines, please? Thanks so much. So as I was just saying, a lot has changed during the transition from when Rocky Mountain was the traditional single entry point and the CCB provider, and we've become the case management agency as of November 1st. That was complicated in itself because there were some counties that moved to developmental pathways, and some of those individuals wanted to stay with us. So that was one complication. Then we had complications from the end of the public health emergency. And there also were changes in the care and case management system, which is where we all correspond back and forth between the counties and all the systems to get you the PARs. So that's confused things. This week, we at RMHS are actually making some changes to our case management models. So one of my partners here at RMHS is going to talk about that and explain how that looks to you as the providers. There are several options for reaching out to us at RMHS. I'm one of them, but we're going to give you some other options. So have your pencils ready so you can jot that information down. We're going to talk a little bit about some of the plans for updating the CSRs and PARs and the plans for upcoming CSRs for the next year or so. So we're going to talk a little bit about that. We're going to talk about how to connect members and providers through the RFP process and explain that a little bit better. So there's a lot coming your way. Take notes. As Victor said, we are going to be posting this slide deck to our website. So watch for that if you want it. Reach out to us and sit back and enjoy. I'm going to turn it over to whoever's next.
That's me. Thanks, Tammy. Hi, everyone. My name is Georgia Edson. My pronouns are she, her, hers, and I'm the Chief Program Officer at RMHS. It's really nice to see so many, well, I don't see a lot of faces right now, but I saw a lot of names when people popped up. It's really great to see everybody. Thank you so much for coming. For those of you that were here on Tuesday, no real new content, no new jokes or anything like that. Glad that you're here too, but don't want to set that expectation too high, because we wanted to make sure that both the providers who specialize in working with individuals on the intellectual and developmental disabilities waivers got some of their specific questions answered. And know that there are some specific things that you as primarily non-IDD waiver providers also want to know about. As Victor said, the slide deck is the same, and we'll do our best to anticipate kind of the questions that we know that you have. As Victor said, people did a really nice job of identifying some things that they specifically wanted information about. Most of those were things that we had already anticipated from the work that we've been doing with you already, the questions that you have, the concerns that we've been addressing with you. I want to say before we jump into kind of where we are and how we got here, our intention was to get in front of you and be with you pretty quickly after the contract changed on November 1. And it felt like all of a sudden a lot of things really happened that felt incredibly urgent. And so I just want to say that this is not the only time that we will get together, that we'll share information in this way. We want some feedback on maybe some of your preferred ways to get information, to get questions answered. If these kinds of events, we're calling them town halls, whatever you want to call them, if these turn out to be useful, we want to know, and we're happy to provide the space to be able to do these on the regular. So that was our intention. Right now, we're really going to focus on some of the things that have been urgent issues, heightened issues, and I'm going to start by giving you a little bit of short history from the last few months, just to make sure that we're all on the same page of kind of some of the things that have happened that have contributed to where we're all at. As you know, the state has been working on on case management redesign and conflict-free case management for many, many, many years. For the single entry point, the old single entry point side, that wasn't as much of a factor, conflict-free case management, because single entry point providers were not also case management providers. So on the IDD side, that was a big change. And the case management redesign that the state has implemented, which started on November 1st, brought together the old single entry points and community center board, CCB, separations, those administration of those different waivers into one entity called a case management agency. I know you all know that. Rocky Mountain Human Services was awarded designated service area 6. That is Denver and Adams. And so the bulk of individuals that we support live in those 2 counties. In addition, the care and case management system that rolled out in the month of July, you can go ahead, Victor, and put all those splashes on there. I think that's perfect. The care and case management system that the state requires all case management agencies and RAIs and counties to utilize was implemented in July, and as is true with any major data system, has had some bumps along the road. This change in case management agency has also contributed to some pretty significant struggles in the care and case management system, not the least of which being things like members associated in the care and case management system to CMA that they shouldn't be associated with. So meaning, for example, if they live in Denver and should be receiving case management services from Rocky Mountain Human Services, we may not have access to that person in the system, but another case management agency may have access to them. So trying to track that down has been a struggle. And some of you, I think, have experienced that too when you've reached out to ask for PARs, and we have said that we're not the case management agency and we couldn't even access information for you to be able to help you with getting some of that information. At the same time, in November, there was a return to in-person continued stay reviews. The annual meetings were required to be back in person as a result of the ending of the public health emergency back in May, and all of the exceptions that were provided on a federal level came to an end, and all of those things needed to be unwound. The unwind is what they're calling it. That includes the going back to, again, you know all of this, people needing to be determined functionally eligible and financially eligible. And if they're not, during the public health emergency, people could not be terminated from Medicaid, but now they can be. And that has been surprising for people and challenging for people as that process has been confusing. So a number of things kind of collided all at the same time, bringing us to some of the issues that you all have been experiencing over the last several months in particular. If we want to go to the next slide, RMHS has recognized pretty quickly that we needed to do some things differently to be able to support members and support providers during this time. And we've kind of had an all hands on deck, everyone rolling up their sleeves to try to do our best to support people. I'm going to acknowledge really loud and clear, we have not been providing the kind of customer service, I'll call it, that we want to. I know that you have experienced long hold times when you're calling the contact center, or you have not received a call back in the 2 days that we typically want to be able to call people back. You have had situations where you've not been able to get prior authorizations. You haven't known who case managers are. A lot of these, I want to acknowledge, we know that that's happening, and that is not how we want your experience to be. And certainly that's not how we want the experience of members to be, and we are working diligently to make that different. Some of that is some of the information we're going to share today to make sure that you know who you can talk to if you have some needs, some urgent needs, some escalated needs. We want to give you some of the contact people to be able to make sure that you're getting your needs met and that you're not feeling like you are on hold for a long time or just dumping into a voicemail box, not knowing when you're going to get a response back. We've been really focusing on making sure that we are supplying our case managers with what they need to be able to get through this too. There's a lot of workarounds that need to happen when the care and case management system isn't necessarily working in the way that we want it to. And so that is part of ensuring that we are also focusing on our operations, that we're doing what we need to do so that you know what to expect from us and that we are accountable to you, accountable to healthcare policy and financing, and of course, accountable to members. All right, next slide, please. I'm going to pass this off to Melissa Emery, who is going to talk a little bit about our case management model.
Yes, hi everyone. For those who don't know me, I'm Melissa Emery. I'm the Associate Director of Case Management here. You've probably emailed me or called me lately. Nice to see you all here with us today. So like Georgia said, I'm going to talk a little bit about our case management model. I think most of you know that in November, we implemented what we called a care team model of case management, where we split out a couple of the case management functions between a couple teams. So we had teams doing our annual CSRs, or those 100.2 assessments, and then separate teams doing typical case management, all the other functions of a case manager. We did this because we wanted to create teams of experts, you know, people who are really good at that support planning component, getting those assessments done. We were trying to make it a little bit easier for people to navigate our very complicated system that we all work in. We know how tough it is. We were trying to reduce stress for the people we mutually support, you all, our case managers, and we really had some great goals with this model. But with all the reasons Georgia mentioned, you know, we quickly recognized that the system's not ready for a model like that right now. It wasn't a good time to try to implement that with all the other challenges we're facing. So we've certainly come to the conclusion that that model was not meeting our needs the last 4 months. And we're currently reintegrating all of our teams, and we're going back to, you know, a quote, traditional case management model. So every member will have their assigned case manager. That person will do their annual assessment. That person will do their quarterly monitorings and be your point of contact for anything that you need. So as we speak, teams are out there reassigning caseloads, you know, getting things situated so we will have that one point of contact for everyone. And then anyone who is getting a new case manager will get a letter in the next couple of weeks giving them the new case manager's contact information. The only exception being that we're keeping intake separate as we traditionally have, just because that function is so different. Next slide. And we do recognize that communication has been a little challenging lately, as Georgia said. We have a lot going on. Some of the things that we currently have and are going to update for you to hopefully help are we do have our staff list on our website that gives the case manager's name, their phone number, and their email address. And we're going to do a quick demonstration of where you can find that on our website if you don't know where to find that. And as Victor's navigating, I will say, you know, this phone list is available to you. It does list the person's supervisor on here as well. You can see whose team they're on. What it doesn't tell you is, you know, the members they're associated with, because we can't put HIPAA information out on our website. It also doesn't tell you who to contact if somebody leaves. So we are coming up with a process to put that on this phone list. We just need to work internally to figure out how to do that and keep it updated for you all. So that is in the works. but here's where you can find it on our website. This is our main page, and you just scroll on down under Contact Us. There's that little button. And he's not going to push it because it pops up an Excel sheet, has to download and stuff, but that's where you can find our current phone list. But we also wanted to put a call out in this meeting. If you have other ideas of ways we can communicate to you all when case managers change in particular, we'd love to get your ideas, because you know, it's hard to, like, we'll do letters, but that's only to the member. That doesn't necessarily get to you. We can do this phone list, but again, if we shuffle a caseload, that doesn't necessarily mean that you're going to know who the new case manager is. So if you have thoughts on that, certainly we'd welcome them in the chat. And then also, if you don't know who a case manager is for someone right now, please email this email address on the screen, cmaquestions@rmhumanservices.org. We have a wonderful team of people who man this email for us and can get back to you pretty quickly with the name and contact info of the currently assigned case manager. And Victor just put it in chat too. So next slide, please, Victor.
Can I just pause for just a second, Melissa? I'm sorry.
Yeah, of course.
Melissa sort of said this, but I want to reiterate. So in going back to a more traditional case management model, that means that what we were calling planning case managers who did not have a caseload of people that they were supporting are going to be assigned a caseload. So there is going to be a change of case managers for people, and that's going to happen next week. And again, the members will be receiving letters with their new case manager name on it. And so while emailing CMA questions at RM Human Services is the right thing to do, I also want to forecast that there are going to be some changes. So be aware of that. That email address is going to be the email address that we give you a lot today, because it is the mailbox that we utilize for lots of kind of specific questions that people can answer that doesn't have to be the case manager. So please utilize it. You know, we staff it appropriately. It is the right thing to do. And then we'll talk a little bit later about what to do if you need to do some escalations.
Yeah, I think that later is now.
Welcome to later. The future is now.
The future is now. Yeah. So yes, if you need to escalate a situation here at RMHS, first of all of our staff put their supervisor on the bottom of their email, their signature. It should list their supervisor's name and email address. So feel free to contact supervisors if you're having trouble getting a hold of a case manager or needs some higher level support to navigate a situation. If you need further support, my email address is on here, as is Georgia's. Going to put out a disclosure to all of you. You probably already know, like, I am quite behind on emails right now, which I do not like, because I want to be able to support you and quickly. I think most of us here are. We're working through them. We'll get back to you as fast as we can. Apologies for any delays. We're getting a lot right now. But please do feel free to email us. And then lastly, there's the formal, quote, complaint process. So if you would like to file a complaint, please email this address on here, clientassistance@rmhumanservices.org. And we also have a team that mans that inbox and will get back to you. And the HCPUF escalation link is on here as well. So that will take you to that Google form you can submit to HCPUF.
And it's back to me, and I didn't have to remember to unmute myself this time. Yay me! I must be getting with it. So again, we've been talking about some of the things that you can do to outreach. If you send communications to the CMA questions and they can't answer them, they forward them to me. So I end up with a lot of the questions that come through that avenue that are a little more complex than what our staff on there can answer. But I'll tell you what, they do probably 95% of them because they're really awesome. And there's a huge amount of emails that come through there. After our meeting on Tuesday this week, I've had close to 100 emails hit my box, and we've been able to resolve most of the questions that people had, or at least acknowledge what's going on, tell them where they're at, and so it's working really, really well. We did want to show you, and Victor's going to click into us. We have a provider information page. And it's located on the far right of our main page where Melissa was just talking about of how to do the referrals. There's some links to different things there. We've tried to fill it up with some great things, but if you have some ideas of things that would be helpful for you to have, that would just be where you could click on that front page, please share with us. We know what we like to see, but there might be things we're missing. So please let us know what would help. We're not going to click into those because, as Melissa said, it takes us to a lot of different places. But when you have time, go out there, take a look at it, and let us know if you like it, if you don't like it, if there's things we could put on there that would be helpful for you. This is supposed to be a shared resource where we're sharing with you what you can get. And in this day and age, I have to admit, I do it too. I look at things that, Saturday morning at 10 o'clock or Sunday evening at 6, and it's nice to be able to look things up on my time and not on, a typical 8 to 5 hour day. So please look there. I wonder if we can go back to the next slide. Some of the things I wanted to talk about, and I'm not sure if everyone knows this yet, but HICPUF just launched within the last 2 weeks a streamlined eligibility process. And we are super excited about that because it's going to take the place of that traditional cert that we had to create and the DSS-1 form that we had to submit to the county. So what's happening now is through CCM, we fill out the level of care assessment for the member, and that information goes automatically overnight to the county, and the county can approve if they have everything for the financial eligibility, and it comes back to us the next night. And then we can load our information up in the bridge if everything's working well, and we can have things turned around a lot quicker. We aren't having to do it manually. So that's something we're really excited about. But it's a little glitchy. We're all trying to get used to a new way of doing things, and people are asking for some of the traditional ways of doing it. So just bear with us. If you have questions, again, send them to me. If we could go to the next slide, if you wouldn't mind. Thanks. So there's a lot of questions about billing that are coming in. And so I just wanted to give a little bit more information about this. We've touched on it a bit, but I just gave you a little idea of what's going on in CCM. There's more, and that's the care and case management system, in case you aren't familiar. I apologize. It would always be nice if we explained what we're talking about. But that's the system we enter everything in, and it has tentacles that reach out through the state's network, and it talks to the MMIS system and the bridge that helps us to get PARs, and it also connects to the counties, and it connects to all kinds of different systems that help this big machine that's Colorado Medicaid. So there's more things coming, but what we can talk about right now is the financial eligibility that's been kind of causing us the problems with things getting lost between the county and our offices. We fax, they fax, we send it by email, they send it by email, and somehow things still just, mysteriously disappear. That should go away with this new system. If you're having problems about getting a copy of a PAR, please reach out to me or reach out to the CMA questions. They can get most of them. I probably had about 40 PAR questions that had been sitting kind of stale for a few days. And today I've just been firing them out of my office like crazy. So the system's finally starting to churn like it should be. And I'm so proud of our team because they've been working really hard to get these PARs turned around, and they're coming out pretty fast. But if you have some that you can't find, let me know. I'll be happy to do some research and figuring out what's going on. We've worked really hard, and I have a contact at both counties in Adams and in Denver, and I also have a contact at Telegen. So when things stall there, I can actually reach out to our contacts there and kind of help us navigate getting those things moving a little quicker, or find out what the bottleneck is. So again, let me know. I'm happy to work those. That's one of my duties here at RMHS. Just a little reminder, we don't have access anymore to clients that are not assigned to us. And that's mostly people in Arapahoe, Douglas, and Elbert that had been with RMHS. Some of them are with us if they did the exception process, but not all of them. So that's a little tricky. Again, if you need help, let me know. Let CMA questions know. There's a
Tammy,
lot
can
of
I-
questions.
Can I just connect
Georgia.
a couple of quick dots? I'm sorry. I mean, and
No,
maybe
that's-
everybody knows this, but I just want to be like abundantly clear about why what happens with the PAR and the financial eligibility. Like we physically can't enter the PAR if there is a financial eligibility break. And so until that is completed by the county and then returned to us, we can't enter the PAR. And there's no like automatic notification like, hey, this is done. We have to go in and manually do these double checks. And so that's part of where the delay is in getting you your PARs. And sometimes when you reach out and you remind the case manager or send an email to CMA questions at rmhumanservices.org, that is a good reminder. And that's kind of what Tammy's talking about, that if the county completes their pieces and we get that notification and we're able to go in and enter the PAR, like it just might be the right time, the right reminder to go in and do that. And so I know that's putting a burden on you. But we also want you to reach out when you need a PAR. And so we can have a way to double check or escalate that with the county if we need to do that as well. So it's just the pieces that fit together in the data system that require us to do things in a very specific order. And if one thing isn't done, you can't complete the PARs. And as Tammy said, one of the things that's also that feels hard is that if we are not named as the CMA in the care and case management system, there really isn't anything that we can access for you. And so that's why we direct you to the CMA that's listed in that system. So just wanted you to know, it's not that we don't want to help out. We would if we could. We just don't have access or availability.
Thanks, Georgia. I appreciate the help on those. It's easy to forget all the details. And if you don't know what county, if you don't know who your the CMA is for that client, either ask CMA questions or send it to me. We'll look it up for you. We can't see anything, but we can see who it's assigned to. So let us know and we're happy to help out. I know CSRs have been kind of a pain point for all of us between all of these changes and the rush to make the public health emergency end and the financial pieces there. Our goal here right now, and we've been doing a big blitz, which I love that word. I think it's a Georgia word she made up, but we've been doing a blitz to get them done. And as I said earlier, I've been able to turn around a lot of things really quickly in the last week. Our teams are working super hard. I found things that I looked at before I took a break and had lunch, and I came back and it was already done. So things are changing very, very quickly right now. Our plan is to get everything caught up in this month right now for the few that are behind. Well, there's more than a few, but there's some behind, and we're getting those caught up as quickly as possible. And we're also working on the March ones. Our plan as we move forward is to schedule ahead. We're going to start getting them ahead in a couple of months. eventually we want to get to the spot where it'll be similar to when you go to your doctor. Your doctor says, I'm seeing you this March. I'm going to put you on my calendar next March. And if the time doesn't work, change the time, but at least we'll both have it on our calendar so we don't forget that it's time to do it again. So that's what we're going to attempt to create for our clients. We know good and well that none of us know exactly what we're going to be doing a year from today, but at least it's on our calendar. So we're thinking about it, the members thinking about it, the providers think about it. We all know it's coming up and we can get it scheduled. So that's some of our plans there. I'll turn it over to who's next.
I believe that is me. A lot of the content on the next slides will be a little more specific to PASAs, working with people with IDD. But we do want to make sure everyone is aware. So in the IDD provider world, for a long time, community center boards have done what we call RFPs when someone needs a service. The CCB would send out information to all the PASAs, say, hey, we have this person, they need this service. Can you provide it to them? Collect the positive responses, give that to the member and their team, and then they would select a provider from there. That is still something that our teams do for people on the DD and SLS waivers specifically. CES and CHIRP a little bit too. So our teams fill out a Word doc. We send it out to all the providers in our system who provide that service, collect those responses, and then give it to the member to select their service provider. Next slide, please, Victor. But I think as a lot of us on this call know, as having worked with the previous single entry point waivers, there are many ways that people can choose provider agencies. And the most common one for the former SEP waivers is that we give people a list of qualified providers. We do maintain our own internal list, but we also give out the HCPF webpage information so people can search for themselves from all the providers that are approved. We also sometimes will narrow down a provider list a little bit, maybe based on location, or if we know that an agency has staff available. That's a big thing right now, actually, is if you have staff available. It's a good selling point for people who aren't bringing their own family caregivers. We might narrow down that list, give the member and their support system, a few names to call, ask some questions. If those don't work, give them a few more, kind of a thing. Or, we might give them, if they're having trouble, we might connect them with another person who can help them navigate the process. There's a lot of different ways to find a service provider for someone, and it's really dictated by the member themselves and the level of support that they need. So we just wanted to put that out there for everyone. Next slide, please. We also wanted to talk about critical incident reporting. So if you need to submit information about a critical incident, if you're going to email in a form, please email that to this address on the screen, incidentreports@rmhumanservices.org, or you can inform the currently assigned case manager of a critical incident. Those include incidents of mistreatment, abuse, neglect, or exploitation, injuries or illnesses that require a hospitalization, a person passing away, those types of things. Please let us know about those incidents within 24 hours. And I do want to say a big piece of information we're often missing for critical incidents is if someone goes to the hospital, which hospital they went to. So please do let us know which hospital they went to if you're telling us someone's in the hospital. That's appreciated. Next one, Victor. And then just some forecasting for the Human Rights Committee, if that's something you're familiar with. HCPF is currently updating requirements related to the Human Rights Committee. That's something that we do here at RMHS, again, traditionally for IDD waivers, where we're really looking at the supports provided to a person and making sure that they take into account the rights of the person receiving those supports. So right now, HCPF is working on removing the requirement that agencies have to tell us when they're supporting someone with psychotropic medications or when there's been an investigation. They told us about this in January. We are currently with our HRC not going to be reviewing psych meds or investigations, at least in the month of March. HCPF has not yet updated the regs and the waivers and everything to catch up with their guidance. So we're following their current guidance, which is we're not going to do this in March. And then if they're still working on updating rules and regs and all of that, we might reinstitute it in April. We'll see. Just a little info there. And I believe Georgia's talking about this slide.
Sure, I'll take this one. Just wanted, we got a couple of questions in RSVPs that were specific to provider rules and requirements and those kinds of things. And we try really hard to just direct all providers to the right place. So either CDPHE, the Department of Public Health and Environment, and the link is on the slide, or Healthcare Policy and Financing, so that you can go directly and get the information that you need about your business. We want to make sure also that our case managers are not providing direction about your billing practices or your business practices as it relates to those decisions that you make as a business. So just wanted to make sure that we included this here. And so if a case manager is not answering something, you may want to determine whether or not it's kind of a business question, like how you operate as a business, or whether or not it's a waiver question. And if it's a business question, here's some opportunities for you to get some questions answered specific to your business. And then kind of as a wrap up before we take a little bit of time to do some questions, just an overall reminder, if you have some feedback about some of the things that we talked about, ways to get information, what are some of the things that you feel like might be most beneficial for you to be able to get information from RMHS or give information to RMHS, please email Tammy. She is going to gather that for us so that we can start implementing some of the things that we really want to, which is regular provider communication. We want to make sure that our website is updated with information that is beneficial to you, including today's presentation, which will be uploaded by the middle of next week. That's also, we also want to do future town hall meetings. And so if you've got some specific topics that you think may be helpful, or if there were things that you liked or didn't like about this particular format, I mean, if you would prefer to meet in person, or the slide deck is not helpful to you, any of those kinds of things, like we're doing this because we want our communication together to work. And so we need your feedback to know if it's working or not. And then kind of to wrap it up, we have some opportunity to go through the chat and answer some questions in the next 10 minutes or so. So we're going to do that. Victor is going to act as the question MC. So if you have not put your question in the chat, please feel free to do so. We'll do our best to answer as many as we can. And if we don't get to some, we will do our best to either answer directly or include some of the answers in something that we post on our website in conjunction with this town hall.
Thanks, Georgia. And yes, Sandy Stone has posted twice now in the chat the location where you'll be able to find the slide deck and recording of this meeting. So please make a note of that. I'm just going to work my way through the chat, and if we've answered it, we'll breeze past it quickly. And if not, hopefully we've got somebody here that can jump in and address it. Here is a good one. Since your transition from Access to RMHS, you promised to have a provider portal. It's not happened. Can you talk about the status of that portal?
I can jump in. Sandy can jump in too, but we are actually updating our website. We're in the process of dare I say, modernizing our website. And one of the things that is really important to us is that we include that provider portal. And so I don't have a timeline for you, but I appreciate the fact that this has been something that we've been working on for a long time. And we are in the process of, within the next several months, launching our new website. So more to come. Thank you so much for that reminder.
Awesome. Next question. Clients are not receiving calls back from case managers. Hopefully information presented today will have addressed that for you. You know, we've given you some options here as far as how to determine who the case manager is. Supervisors are on the emails. You can contact supervisor. You know, we've given you several methods of doing that. So I hope you feel satisfied with the information we provided there. We've got Melissa getting some well-deserved love in the chat. All right. And Melissa, you addressed this in the chat. What's the expected response time for supervisors, et cetera, when escalation is required? But do you want to maybe just say that verbally as well?
Yes, definitely. Prior to 11/1, our expected response time was 2 business days. Given our current state, and like I said, certainly my response time right now, we're getting to things as soon as possible. If you don't hear from us, we welcome a second email. You know, send me 2 or 3. Just let me know if you need something more urgently, and our staff are the same. You know, please keep reaching back out and continue to escalate up the chain if needed.
And I want to reiterate again, this isn't how we want to operate. And so doing all the things that we mentioned in order to kind of get caught up and be able to provide some good support and customer service. When we put the supervisor name on emails, it isn't intended to get somebody in trouble. It's intended to give you a resource for somebody to call. And so if you aren't getting what you need, it is absolutely okay. No one's going to be upset if you reach out to the supervisor. And in fact, we want to make sure that you're getting your needs met. I mean, this happens to Melissa and I all the time. You know, we are kind of tag teaming responses to make sure that people get a response as quickly as possible. So please don't hesitate if you're not getting Melissa, it's okay to email me. In fact, it's helpful, right? It's helpful to know that you need something, and if I can respond, and answer your question, that's helpful to Melissa, and that's helpful to you.
Yeah, definitely.
Thanks, Trevor. All right. Is the communication emails for both PASAs and LTSS? Melissa responded in the chat. And yes, these are for all of our providers. We are able to take questions from any type of provider through the methods we've given you today. All right. Can we send PHI to the CMA questions email? Yes, you can, through an encrypted email. You must use your encrypted system to send that information. Melissa, I'm waiting on an intake for the ULTC cert since last year. One client was told when I submitted a referral in December, they didn't have an opening to assess until 3/20/24. Do I contact you about this?
Contact me.
Yeah.
Yep. Feel free to reach out to me. You're welcome.
Thank you.
Why in the world can't we get a system that would alert somebody when a member is ineligible?
High five.
Yeah. I don't know if I think that's a rhetorical question. We would all
Yeah.
really appreciate a system like that.
We would.
Many of the case managers caring for my clients say the PARs are ready, but there is an eligibility break. Do you know what the eligibility breaks are about? Is that about the financial eligibility renewal process?
Yeah, this is a good one to spend a little bit of time on. And I did put in the chat, but for those who maybe can't see, as Georgia talked about with the public health emergency unwind, financial renewals are now required every year for members again to stay eligible for long-term care Medicaid. So they're getting information from the counties in the mail. And this year, on top of the PHE unwind, where they've been able to ignore this paperwork for 3 years, there's a signature page in the paperwork that they have to sign and send back, even if nothing has changed. And if they don't send back that signature page, they're going to lose their benefits. So I want to put in a plug. When you're working with people, please talk to them. I know you're not going to know timing either, but if they get something in the mail from Medicaid or the county, they need to pay attention to it because it's important and it will affect their benefits. And so, yes, a lot of what we're seeing are financial eligibility breaks. So they're going through that renewal with the county and maybe haven't submitted their paperwork, or maybe they have and the county hasn't been able to process it yet. We see a lot of that too. The thing to keep in mind that's important is that that county renewal date doesn't always align with their certification end date that we do for services and PARs. So if we're seeing a break in the middle of a cert period, it's likely a financial break. The other thing I want to say is Tammy talked about streamlined eligibility in the systems, which is very exciting. But as all things, rolling it out came with a couple of glitches. And one of those is that a bunch of people had their benefits erroneously end dated on 2/29. So that could be causing some of the breaks that we were seeing too, although we're hearing that one has been fixed. So there's a lot of different reasons. If you have questions about an eligibility break, please email the case manager, their supervisor. We can help you research what's going on.
Awesome. Thanks, Melissa. All right, next question. What if a PAR needs an error corrected? Who should we address? In particular, if it's a prolonged issue that has not been resolved? Would this go to Tammy or the current case manager?
Yeah, you can certainly email the current case manager, their supervisor. You can include Tammy, me, Georgia, any of us. We can help support to get that fixed.
You.
I think we want to say there's no wrong door. Just contact us and let us follow up.
Yeah, I think one of the things that's helpful with things like that is we don't want to do things excluding the case manager. So I would start there. And certainly you can CC us. But we want to make sure that the case manager is doing the management and that you've asked them to get this completed. If you're not getting a response, then absolutely escalate.
Awesome. And the question was, our county's getting caught up. Georgia, you responded to that in the chat. Did you want to say anything?
Not quite yet.
Okay.
They're not quite caught up yet.
There we go. All right. How do we inform you if we have enough staff? And that came up during the referral part there. And Melissa responded to email her and let her know if you are sufficiently staffed and wanting to take on additional members.
Mm-hmm.
Again, the PowerPoint and recording will be posted, and there's the link. Will there be another system in place next year for financial eligibility renewal so we won't have to go through this chaos again?
Yeah, I wish that we could say yes. The financial renewal is required from the federal government, actually, the Centers for Medicare and Medicaid Services. So there's always going to be a financial renewal for folks. What it looks like might change over the years, but that's always going to be something that people need to go through. And I don't anticipate anything looking different in the next year.
All right, we've got some timeline questions here. How long is it taking to schedule and complete assessments for new enrollments?
I can jump in on that. A lot longer than it should for a number of reasons, and it also kind of depends on what service that the person is looking to enroll in. It can take longer because of not having a service provider available, not having all of the information. Again, that financial eligibility piece. There are a number of contributing factors. If you know of somebody who you feel might be stuck in the process, feel free to reach out to me or have them reach out to me, and we can update them on where they are and what they need to do to complete that eligibility and enrollment process.
Great. We've got another question about timing. I'm going to try and boil it down. Vanessa's asking about getting the CSR done. She says that they try to be proactive and reach out to the case manager about a month before a PAR expires, and they've been told by case managers that it's too early and they can't provide a PAR. However, case managers forget to do their assessments, and then we have to wait for PARs after their expiration. Sometimes that takes longer than 2 weeks. When can we start requesting the new PAR?
Yeah, that's a great question. I think what you're experiencing is related to how we had separated the planning and the primary case managers in November. Having the planning teams do those assessments and the timing of everything did get a little complicated, which is one of the reasons we're going back to just having a primary case manager for everyone. Right now, we're working in the month of the end date. So we're working on March end dates right now, just to get ourselves caught up from the last 4 months. In the future, like we said, we're scheduling assessments a year out, and you can certainly provide information to the case manager about that assessment beforehand, month or two. But our goal is to hold the assessment 2 months prior to the end date to give us time to work through everything, get those Telligent approvals, get those PARs done, and you have it well before services start.
Right. I think that might have addressed Irina's question too about after the catch-up phase, what is complete, what's the expected turnaround time for CSR completion as well as PAR completion. We used to follow a 10-day rule when providers had 10 days to submit a PAR. So, and ask the question also about our case managers receiving any standardized training about the rules and expectations and the impact delay process have on providers and ultimately the people that are served.
Oh, yes. Yes. As Georgia has said a couple of times, we do not like the place that we're in right now or the impact it's having on you and the people we mutually support. It's really hard, and we certainly understand the impact, which is why we're making changes to address it. And they do go through standardized training. Every case manager who's hired here has to go through a set of trainings, both that are required by HCPF and the ones that we've added that we find value in.
All right. We are running real short on time. There's one HRC question. So no HRC for psychotropics or BISSPs.
Yeah, HRC is going to be looking at rights modifications. So if you have that ISSP in place and it involves a right modification, that certainly needs to go through HRC. I was looking back at my notes because I saw your question. I'd have to look at the new regs to be sure I'm saying this right, but there was something about emergency versus safety control procedures and what those were going to go through, but we'll give you more direction when we when we have better info. I don't want to give you misinformation right now.
All right. We got a question about a backdating. I'd say reach out. That's pretty client specific. Please reach out for an answer on that. Will case managers have smaller caseloads until all the problems are fixed?
Yes, we're creating, smaller is not a word I would use. We're creating caseloads based on the work that they do every day. We have done a lot of work with our case managers, identifying the tasks that they do every day, how long those tasks take, building in time for phone calls and emails and answering questions and all of those things. So we're building caseloads based on the work that they do every day and the feedback they've given us for how long that work takes.
And I just want to say that the case management that's required from case managers right now is radically different because of all of the things that we talked about, not just the system issues, but kind of the requirements and the environment that we're in and those kinds of things. And so it feels like a different kind of case management than what was provided even right before the pandemic. And so we're adjusting to really looking at how what's manageable for a case manager and what we should expect. Right now, case managers are saying that they're spending about 18 hours a week on the phone with just answering phone calls, your phone calls, members' phone calls, escalations, returning phone calls. So almost 50% of their time isn't necessarily doing the kind of contract requirement stuff. And if you're not getting calls back, they're on the phone with other people. And so that's kind of the volume that they are operating under right now. It's a lot. And again, we're doing our best to level out that work and those requirements so that we can really make sure that we are on top of CSRs, that you all are getting your PARs, that people are getting the support that they need.
Absolutely.
Thanks, Georgia. And we are over time
Overtime,
already.
yeah.
I don't know if you want to just have any parting comments, Georgia.
Yeah, I just want to say thank you so much. Please give us some feedback. Let us know if there were things that were helpful. Reach out to Tammy, Melissa, myself in particular if you have questions. Utilize CMA questions. Email address, please. We think it's been helpful for people, and we appreciate your time.
Very much. Thank you all.
Thank you, everybody.